So I actually think I can start with this overhead in the interest of time because it's not graphic, and even though you're in the back of the room, you can hear me. Basically, there are two broad roles for data from our perspective. There's an internal role to inform the program and its management and its operations with respect to monitoring the program's performance, monitoring staff performance, identifying any problems with implementation or administration, and also to reinforce what's important. There's also the external role, and you're straddling that by your presence here today. That's to substantiate your success, to respond to any kind of criticisms or concerns or issues that bubble up, to identify opportunities to strengthen your program efforts or to improve your ability to document the success of your efforts. Certainly to educate your constituency, and that may be your partners, local policymakers within your own communities and state, and certainly at the federal level if you have federal funding, which those of you who are here do. And to educate the public, because it is the public that very often drives policy and funding resources for policy and practice. And then it also gives you an opportunity to define performance on your own grounds, on your own terms. So many of the comments I'm going to make today are actually adapted from a coaching packet and a webinar that I produced with a former colleague for the Center for Effective Public Policy on measuring the impact of reentry efforts. And I've given you the link to that particular coaching packet, but there's a series of about 10 or 12 coaching packets that you may find useful to you. They were developed for the Prisoner Reentry Initiative of an earlier generation. So I want to talk generally about performance measurement and laying down a baseline for data. Performance measurement refers to the regular and systematic collection of quantitative information that empirically demonstrates the results of activities, whether the activities are changes in policy and practice, or whether it's program or services. And performance measurement connects quantitative indicators with the specific agency or jurisdictional expected outcomes. Now, I make a distinction between performance measurement and performance management because management is the system of not only regularly collecting performance measures, but importantly, using this information to increase efficiency in program approaches or in service delivery, and also of reporting the indicators of program operations and the results. We've found, despite the topic that you're looking at, what is measured and reported gets attention. So with respect to the Second Chance Act programs, you probably could think generically, regardless of what track you're in, about measuring success along three dimensions. The first dimension is what I consider to be the core processes, and that's assessment. Are you getting the right people? Are you getting the population that you targeted into your intervention? The second dimension is along the lines of case planning. Have you measured in a systematic and valid fashion what the risks and the needs of these individuals are? And have you documented that so that for the third subtask there, you can track the engagement and completion? That is, relative to individuals' needs, what program activities were they actually connected to? How does it match their case plan? What services did they enter? Which ones did they complete? And you may want to track, probably should track, the nature of those services and the duration of those services. And I will say that one of the things that's critically important that is often left out is that you want to track when people exit so that you are able to discern whether those who had less success did so because they had a very weak exposure to whatever your intervention was, or despite the fact that they successfully completed the intervention, but it didn't produce the kinds of changes that you anticipated. And it's helpful, I find, if you're designing a case-based data collection database, to also document the reason why people left the program early, whether it was of their own volition, whether they failed to comply with other supervision or program requirements, whether they were reincarcerated due to commission of a new crime or a technical violation. The second domain or dimension that you probably want to track has to do with the key reentry indicators of changes, hopefully positive changes, in employment, in the acquisition of stable housing, in the receipt of substance abuse treatment and the individual's ability to attain a drug-free life and to retain sobriety over a period of time, and also to track mental and physical health, services received, and the improvement in the individual's health picture as a result. And lastly, there are the public safety indicators, the ones that probably first come to mind when people think about tracking the results of their efforts, and that's rearrest, reconviction, readmission to jail or prison. And here I would encourage you to consider tracking that by cause, whether there is a readmission, reincarceration due to a new crime, a former crime that suddenly came up and took the person out of the program once they had started, or a technical violation. And lastly, there's the successful completion of supervision. So some of the key analytic considerations that are the basic kinds of analyses that can be performed using quantitative data are to calculate the outcomes for all clients, or to calculate the outcomes broken out by key client or service characteristics. So disaggregate it by the nature of the population you're serving. First offenders versus chronic serious violent offenders. People with substance abuse problems, mental health problems, or co-occurring. Those who have certain kinds of criminal offense histories, sex offenders, those who have only had histories of misdemeanors versus felonies, etc. You also can compare the current outcomes with outcomes from earlier reporting periods. That can be earlier reporting periods within the context of your program operations, so that you can see whether the program is doing better with each year, or semi-annually or quarterly, or you can actually look at the outcomes of people in your program relative to similar populations in your local community before the program was even implemented. You can compare the latest outcomes with preset targets. If you're heading to reduce crime by 50% in 8 years, you might want to be thinking in terms of 5% a year for the first couple years. Or, and I recommend this, although it's not always the funders' agreement that you should do this, that you should set your targets by looking at what has been accomplished in the past, so that the targets themselves are realistic. If you've never reduced crime by more than 5% in a 10-year period, it's a pretty heavy lift to suddenly go to reducing it to 50%, if that's never been done. So you might want to cut it out into something that is aiming high, but that's feasible, and then compare what your actual achievements are to what you set as the target for performance in any given time frame. And lastly, you can compare your outcomes with other similar programs so that you could look at your outcomes relative to other grantees in your track, or to nationwide outcomes with respect, for instance, to recidivism, or to any other kinds of benchmarks. So I want to focus your attention on not just collecting information, but collecting it and recording it at the right level so that you can use it for analytic and program management purposes. And this is a slide I like to use because it's pretty generic. It shows you two hospitals. On your left is Mercy Hospital, which annually takes in 2,100 surgery patients and has an average annual death rate of 63 patients per year. It's a 3% overall death rate. And on your right is St. Simpson's, and they only take in 800 surgery patients, have 16 deaths, which is a 2% overall death rate. And I ask you the question, if you can go to one of these two hospitals for your surgery, where would you go? I would say Mercy, because you need to have more data than simply the 3 items I gave you to begin with. What you're actually seeing here when you collect a sufficient type of data is that Mercy Hospital is a teaching hospital. And yes, they have an overall higher death rate, but that's because of their 2,100 surgery patients, 1,500 were in poor condition and not expected to live. The other hospital is a local hospital, and only about a quarter of their patients were in poor condition. So in effect, Mercy performed miracles. It had a slightly higher death rate, but it also had an extraordinarily higher survival rate of those who were expected not to be able to make it through surgery. And you have similar kinds of instances in your daily life with your populations where you have to think in terms of what is the data that reflects the circumstances and the results you want to achieve. How should you measure progress? So one of the other things you need to think about is what is the relevant denominator, and it varies under different circumstances. So one possibility is to look at the number of people who improved and compare it using as your denominator the number who were enrolled. So if 30 improved and 100 enrolled, you have a 30% improvement rate. The alternative is to look at those who improved after they completed the program. So if only half of the people who enroll actually make it all the way through, and 30 of them actually improve, you have a 60% improvement rate. Whether you measure both of these or only one is dependent upon the kinds of responsibilities you have. If it's your job to ensure that 100% get through the program, you don't have much option with respect to the second choice. But if your job is to do both, get them in and then do your best to try and keep them engaged, then you could measure both and be able to look at whether the program is a success for those who you're able to retain in it long enough. So you want to determine what should be reported into whom, select reporting formats that present the findings in a clear and understandable way. And we always recommend that you not just present the findings, but that you put them in an explanatory context so that you can conjecture, if you can't prove it at least, what is accountable for the outputs or the outcomes, why they look high or low. You may have a year in which there was a significant state budget or local budget resource cut, and caseloads went from 50 persons for community-based supervision to 180. Under those circumstances, it may not be a happy finding, but it's not an unusual finding to see that success might slip a little. So I ask you to ponder these things as you're listening to the remainder of the presenters. If you could get the question, the answer to one question through data, what's your most critical question? Who's actually reviewing data on your program, and when are they doing it and why? And think about internally and externally. I'm asking you to say, who are the users of your information and what's their purpose in using it, and what's the period of performance that they need? If you're looking at parole supervisors, they may want to have data collected in such a way that they can look at quarterly measures. If you're looking at funders, semi-annual or annual may be sufficient. You need to keep your raw data in such a way that you can respond to those different constituent audiences. Are you able to use the data prospectively to identify opportunities, either to improve the program or to go for additional funding or something to strengthen the program and improve the results? And can you do this with your own data only, or do you need to access other sources of data, and can you do that? And lastly, how many people in your organization can produce the data and, importantly, can use it? Thank you.
I always hate my big fingers on those little tiny computers there. The reason that I was asked to talk to you a little bit this afternoon is that the other people on this panel are all from the technology, from the data research side. I'm from the operations side. And how do you use this data to influence how you design your programs? How do you use this data to influence what you do as an organization from the operations side? Every organization has an organizational vision. They have organizational guiding principles or goals, beliefs, values. They have a philosophy. You have to have something that you believe in that will happen. And for us, our belief system is that we can change offender thinking patterns and behaviors. We can improve our system to support successful reentry, and we can review those policies and modify those policies that can reduce recidivism. Our goal is to reduce recidivism by 50% over the next 5 years, and the Second Chance Act grant funds are going to help us assist us in reaching that goal. 3 goals for the Second Chance Act grant. The first goal is a collaborative goal of working together with our partners in the state to change offender behavior. The second goal is to evaluate our assessments, evaluate our programs, evaluate our case planning to look for ways that we can do a better job, to look for ways that we can apply evidence-based practices to what we're doing in our agency. And then the third goal is to reduce that recidivism by 50% over 5 years. And we're going to do that through assessment, through case planning, through analysis of the service gaps that we have in our organization, to address our parole violation issues. Why are people violating parole? Are there gaps in the system that are contributing to that violation of parole? Are there service gaps? Are there program gaps? What are the gaps that are contributing to that parole violation? And then to look at our hurdles to reentry. There's policy hurdles. There could be statutorial hurdles out there that are decreasing the chances of a successful reentry. So our collaborative team structure for the state, you've got the Governor's Reentry Council, which is comprised of the secretaries or the chief operating officers of the Department of Corrections, Department of Health Services, Social Services, Department of Education, Motor Vehicles. South Dakota is a bifurcated state, so probation and parole are not under the same agency or jurisdiction, so we're working with our UJS, Unified Judicial System, and the mayors of our 2 major cities in the state, which is our focus groups or our target groups for our reentry initiative. The reentry group is the state agency directors. Those are people like myself who make things happen in the state. They're the deputy directors of a lot of the state agencies. And then under that, we have our 2 reentry task force that are comprised of local people in each one of those communities, law enforcement, social service agencies, employment agencies, housing agencies, faith-based providers, human services. All those agencies are comprise a local task force that provides guidance and support and direction for individual inmates and also for the community services that are provided. We start with our admission and orientation unit in our prisons. We define who is high risk. First of all, we define who's high and low risk. Roland will talk about that in a little bit. And then we respond to that risk and match programs based upon a higher or lower risk offender. And then also look at the dosage, the length of program, or the intensity of that program based upon whether someone is a high or lower risk individual. This is kind of small print. You could have a tough time from the back. But basically, if you looked at the left-hand side, it's our low-risk people, short-term programming, divert them to work release, get them out of the institution as soon as possible, some very low-intensity case management, and move them toward an early final discharge of supervision as soon as possible. On the right-hand side, you have the individuals that have been identified as high risk. We intensify the programming for that group. High level of institutional contacts. The policy requires more contacts in the institution for people who have a higher risk to recidivate than those that are at a lower risk to recidivate. If they're referred to our Pennington or Minnehaha County, which is our 2 target communities in the state, then we can refer them to the local task force if they have issues that they need assistance on in their reentry program. High intensity case management from either the community task force groups or from their parole agent. And upon a parole violation, we can then divert to additional resources in the community, divert to the task force, or return on a parole violation basically as a last resort. Programming in the institution. This is our programming or the programs in the institution and on the streets focus on recidivism reduction with our partners. The JSAP program is a program put on by the Department of Labor. Lutheran Social Services provides our consumer credit counseling course, and these are through our collaboration or working with our local community agencies to get them to assist us in putting on these programs in our institutions. We used to have a bunch of what we call electives. They were additional courses that had just been around for a long period of time, and we've eliminated any courses in our institution that are not an evidence-based course. They do not concentrate on recidivism reduction. We eliminated those because we want to concentrate on programs that reduce recidivism and that are evidence-based. We evaluate the programs to make sure that they're evidence-based, that they're based upon cognitive behavior changes, and with the CPAI. We work with other agencies to develop those programs and look at our community transition program. We started a community transition program years back, and there's just lots of busy people in the institution. And what we found out is that rather than looking at the assessed risk and needs, they were dumping people in the program when they had a difficult case. So we started guarding the front door, we call it, of our community transition program to make sure that only the people that are of the highest risk and need are referred to our community transition program. Parole Board, it's very important to work closely with the Parole Board. We've been providing more assessment information to our Parole Board. Parole Boards really like to use their own clinical expertise to make a lot of those decisions. So we are providing additional assessment information to our Parole Board. We have our institutional case managers, our transition case managers, present with the offender and the offender's family when they talk to the parole board about a discretionary release decision. So we've got not only the offender there, we've got the institutional representatives, our transition representatives, and family members also present at that hearing. We've also created alerts for very high-risk offenders. There are bad people out there that deserve to stay in prison, that need to stay in prison. And so we've identified the high-risk offenders through an alert. We're not telling the parole board not to parole those people. We're just telling the parole board, if you choose to parole this person, we need a very high level of surveillance and intervention and treatment in order for them to be placed in the community. We've also increased our rewards for positive reinforcement. We created a partial early final discharge from supervision. We had previously had a full early final discharge. In some cases, the parole board didn't necessarily want to cut the person directly to the streets, but as an intermediate reward, the parole board is granting partial early final discharges. We also very cheaply pass out certificates to offenders in the community upon program completion or upon different levels of employment attainment, 6 months on the job, a year on the job. We've created a certificate program where we send them to offenders. Community case management, look very much at a success-oriented supervision strategy. We've adopted the proactive community supervision that we've all heard about. Get the family involved with the supervision, get the community involved with the supervision. We've reduced the negative reinforcement and increased the positive reinforcement. We've got a policy-driven response to parole violation, a PDR, that is basically the negative reinforcement. When you do something wrong, then we respond appropriately with something negative that's going to happen. We've looked at our PDR chart, our matrix, and have reduced some of the consequences on that at the same time that we're increasing positive reinforcement. Indirect supervision, we used to have about 7 to 8% of our population in the community on indirect supervision. We've moved that up to 21 to 22% in the last 6-7 months by just concentrating on which people are low risk and do not need that level of supervision. That creates some staff time again to concentrate on the high risk or higher level people in the institution. So in effect, we've reduced our enhanced caseloads, we call them, with our parole agents. We've reduced their caseloads by 10 and put caseloads of up to 160 on for the officers that are supervising indirect supervision caseloads. Also, there's staff training involved with this, to train staff not just to look at surveillance and look at consequences, to look past the violation severity scale, look at a cost-benefit analysis of a decision. We know what prison is going to cost. Are there alternatives in the community that we can use and apply that is going to save the state money and actually enhance the success of an individual? We try to do the right thing every time, do the right thing with the individual case. And you stress to people when you're in the field, this isn't hug a thug. That's the major concern for most of the people in the community, is that you're going to turn this into one of these social service agencies. This is not hug a thug. It's risk assessment, it's risk management, it's assigning programming to high-risk people. We all have a surveillance, at least in the parole division. We have a surveillance responsibility, but that is a pretty minor responsibility, and we're going to not get very much bang for our buck on a surveillance mode. We're going to get more bang for our buck from a program mode. So what we have is what we would call our intensive case management that starts with the admissions unit. We set standards from the very beginning on how many contacts you're going to have with low and high risk offenders in the community. We work on our handoffs between the different portions of the system. The admission case managers take the case, evaluate the case, assign what we call an individual program directive, which is basically the institutional plan. If the person is compliant with their individual program directive, they are released to the community on parole without going through the parole board. So it's based upon an assessment, program completion in the institution, and if you do what you're told in the institution and comply with your case plan, you're released to the community without going through the parole board. We develop that IPD in the institution, hand it off to the institutional case managers for the period of time that they're in the institution, to the transition case managers during the last 6 months of the sentence, to the task force if necessary for high-risk offenders, and then on to the parole agent for community supervision. What we saw through our analysis is that we think we were doing a great job of a handoff between these various portions of the system. Even though they're all under the supervision of the Department of Corrections, we were still not doing a very good job of handing an offender off from one portion of the system to the other. So we've created a very specific intensive case management policy which dictates not only contacts, but it dictates how you make the handoff to the next part of the system. So that's the operational portion, and that work is based upon what Roland is able to tell us about the statistics and the research he has completed on what programs work, which programs do not, and how we need to change the operational portion of our institution or of our organization to match what the statistics are showing us. Thank you.
Thank you, Ed. Ed's the director of our parole services in the state of South Dakota. I'm Roland Laudenberg, and I serve as the evaluator for our Second Chance grant, both on the adult side and the juvenile side. Ed has and his staff have done a fantastic job in believing in what data can tell them and how it can help them drive their programming and their services. And not only Ed, but our leadership within the Department of Corrections as well. Our secretary and deputy secretary both have believed that we can make changes based on data that will actually influence our recidivism rates and our results. So with that, I don't know how come we always draw the afternoon slot with data, but we will try to keep you entertained. I don't know if we have any data groupies out there, but we'll try to keep you entertained here and keep you awake through this. We start with our numbers. Where were we? What was our recidivism rates? And what does that tell us about the types of services we need to be looking at, and how do we change the current services we have? You can see on the slides here that we have about 2,100 to 2,000 releases over the last 4 or 5 years. And of that, we have recidivism rates at the 1 year and 2 year and 3 year marks that we're able to measure. And so our latest number is releases in 2007 that we can use, our latest number that we can look at are releases in 2009. And our recidivism rate in 2009 at 12 months was around 28, 29%. But you have that 1 year period to really look at this recidivism rate, and that's a little frustrating for some data folks and some program folks as well, because if you're using that number to drive your change, it takes a while to really get to that number, okay? But you can see we have quite a road to move if we're going to reduce our recidivism rate by 50% within 5 years. I should state that that wasn't just a second chance goal, that was also a challenge laid down by our Secretary for Corrections based on discussions with the governor and the cabinet saying, we will do this. And so we have been on this road even before we were funded. Okay. So if we're going to truly look at that and try to reach that goal, this is what it means for our recidivism rate, our 12-month recidivism rate over the next 5 years. And actually by 2014, the goal is only 15.6% of our releases will recidivate within 1 year, okay? Which is a pretty ambitious goal. For us in South Dakota, we are a fairly small state with only about 2,000 releases a year. What that means is in about 2009, we had about 590 individuals that recidivated in that first 12 months, okay? What that means for us in terms of making this a reality is that we have to be successful with 270 more people in the year 2014 if we hold the numbers the same as at about 2,100 a year. And so we need to think about how can we change the lives of 270 individuals that are in our parole care, in our care of our systems and services, okay? I did this slide to kind of make it look, how do we change that over time? What are the things we need to be thinking about to reach that goal? when I give lectures, and I do a lot of lectures related to data and making changes based on actual data, and I like to use this slide because it drives home the point that our perceptions are not always in line with reality, okay? And the same is true of why we use data. We go back to data to understand what really is happening. What can we work on to make changes out there within our services, within our programs, that really are going to create change and make a difference, okay? So to reach our goal, we really need to target our recidivists. Who are those folks? What do they look like? What are their characteristics? What are their families like? All those types of pieces of information become very important if we're going to affect the lives of those 270 individuals in the year 2014 when we need to be reaching our target of 15.6% recidivism rates. Ed shared with you earlier on the overall objectives of the grant, and within that he had an evaluation goal. Well, within the evaluation goal we have 5 separate objectives, okay? Our overall evaluation goal is to evaluate the current institutional and community program processes to determine the impact on recidivism, okay? Underneath that we have 5 very specific goals, and they correspond to, some of you were at the presentation earlier by Richard Stroker, and also with Shelli's comments earlier in terms of her focusing on core processes, reentry indicators, and public safety. And so I think those are embedded within each of these 5 goals, and you'll see how they start to align. Essentially, we're going to look at, and what we've been doing is evaluating how we're addressing and how we're planning for cases within the institution. Is it risk-based? Is it needs-based? Are we using evidence-based practices? Do we identify the types of programs those individuals, those inmates need to be in? Okay? Then, once we've done that, we're looking at the institutional programming to determine impact on criminogenic risks and needs. And if you were at the earlier presentation by Richard, you saw he was really focusing on those particular criminogenic needs. We're doing the same thing within our institutions, looking at our programming and seeing, are they based on addressing the needs of the offender? Are they evidence-based? Do they meet those needs? And is there evidence to suggest that we're going to make changes within those individuals? Then we're mirroring that same activities on the community level as well. So we're looking at, are our community case planning and assessments, are they evidence-based? Are they risk-based? Are we addressing those needs again on the community side once the offender's been released? And then we're also doing the same thing, looking at short-term outcomes and long-term outcomes in terms of the actual community programs and services. Shelli mentioned you need to look at, are they in substance abuse treatment programs? Do they complete those programs? Are they attending regularly? Were they successfully discharged? All those types of components lead to successful reentry and providing those services. And then finally, our last objective is really the kind of the big overarching objective in terms of the evaluation objective is, what are those root causes of recidivism? We go back and we look at those data again and see, are we being effective at addressing those root causes of data? And so the process actually starts all over again at this point. Now, many of you just were funded in this last few months, correct? My understanding? So you are starting to figure out, okay, what's our target population and how am I going to measure change in that target population moving forward? I'm trying to make sure I'm going to address the needs that we were intended to address, so wanted to confirm that. So how did we do that in South Dakota? How did we get started? Well, how many of you were in the 3 group in Richard's presentation? Anybody? You remember what he said? What was our... Okay. Well, I think that's number 2 or 1. So number 3 was, in the middle of difficulty lies opportunity. Okay. I go back to that just to kind of add a little bit of humor and entertainment to our presentation that's very dry with data, but in a way we did that. We went to our data to look at what can we learn, how can we use it to drive our systems going forward. Well, it was a bit of clutter, it was a bit of difficulty in looking at all that information. I do have to really congratulate our Department of Corrections because they are very good at collecting data, and they had a lot of data that we could look at and begin to tease through to try to help identify what are the key components we need to be focusing on moving forward, okay? So we looked at our 2007 and 2008 release data, and we analyzed it and examined the recidivism trends and what are the issues that seem to be driving those recidivism trends, okay? And so what we found is that our males recidivate more often than females, okay? And so we had about 30% of our males compared to 25% of our females recidivated. Our Native Americans and other races in South Dakota were primarily 85% white Caucasian state. A few other ethnic groups and racial groups and Native Americans comprise about 10% of our population. And we have a disproportionate number of Native Americans incarcerated as well as minorities compared to our population, which is probably fairly similar to many of the other states. But our Native Americans and our other races do not have as good of results at the 12-month mark in terms of recidivism as our white Caucasian populations. So we looked at those issues. So we need to have some specific programming for Native Americans that targets those populations. I should state that our other race is a fairly small number of individuals, so it's very difficult to program for a very small handful. The other thing that we looked at is we looked at recidivism by age, and we looked at it by gender. And we found statistically different rates of recidivism when we looked at age. Our younger folks were recidivating at a much higher rate compared to our older folks. And the average age of the recidivists that we targeted, if you were below 30, you had a very high rate of recidivism compared to individuals over the age of 30. Okay, it was very distinct in the data. This one just supports that, and the red line up there is our recidivism curve in terms of our young individuals 20 to 29 years of age. And they really, as you can tell, just drop below the other age groups quite dramatically. Then we also had the good fortune that our institution had adopted the LSIR. They've done other assessments as well. They have a beautiful risk assessment that they use as the person's getting ready for discharge. But we wanted to come back and use the LSIR because we could dovetail that into programming very nicely. And so what we found on the LSIR is that it gave us the same kind of demarcation in terms of recidivists. Those individuals with higher recidivism rates tended to have much higher LSIR scores. Seems to make a lot of sense, and I can't remember the correlation and the research that was presented that was found with, that supported that from other studies, but we found the same thing in South Dakota. What we found is that an individual that had an LSIR score of 30 or above, whether they're male or female, tended to have much higher recidivism rates compared to those that did not. So a male that had a recidivism within 12 months, their average LSIR score was about 30.4. A non-recidivist male, their average LSIR score was about 28.4. For females, it was very similar to that, slightly lower for the non-recidivists. Okay? What this graph begins to show you, and this is for all releases, is where you start to see the climb in recidivism rates by their LSIR score. And you see a dramatic jump as the curve starts to get very steep around an LSIR score of 22. Okay. We then looked at it by males and females, and you see similar things for the males. And it jumps up in that grouping about 22, and it really climbs till 30, and then it stays very high after 30. For females, we had an early spike, but there's only a few individuals that had the lower LSIR scores, and should know that we had a few years ago, we had a spike in women coming into our prisons with methamphetamine issues. And it's my hypothesis. I can't prove that right now, but that's why we saw that peak right there. That peak only represents just a small portion of women, so there's not a lot of individuals that are represented in that lower LSIR score. But same type of thing. They tend to level off at about 22. They don't have as a dramatic increase. And I see a lot of you shaking your heads. It seems like that's pretty similar across other states and other data sets that I've looked at as well. And so what we came back with, and we looked at a whole bunch of other factors and indicators as well, but these two, age and LSIR scores, seem to be the strongest ones for us at this point. And so what we decided was to look at an LSIR score for males of 30 or greater and age 30 or less as our target population for males. And our females, we decided to look at an LSIR score of 23 or greater and an age of 30 or less as our target population for our females. Other drivers that came up on the LSIR, which should not surprise anybody, Richard talked about them earlier, were education, employment, living and residential, substance abuse services, mental health, and attitudes and orientation. I should also indicate the criminal component subscale came up high as well, but that's not something we're going to be able to change very well, so we decided not to target that. We decided to target these things that we could change with programming. Okay? So then what we did to confirm that we were on the right track is we went back and applied these criteria to our prior releases to see whether or not we were still targeting that high-risk group, and it still came out, yep, these are the ones we ought to be targeting. And so far, and I'm anxious to apply this to the 2009 data that I just got and see how it shakes out. But so far, on our intermediate checks, it's been identifying our high-risk pool. What we've been doing then is we have the individuals going to, and if anybody been to South Dakota? Okay, so a few of you have. Anybody driving the country roads? Okay, so do you see anybody go like this on the way by? That's our Dakota twitch, our wave. 2 fingers, you're not from our state. It's got to be 1 finger. But so we have a large span of open area in between Sioux Falls and Rapid City. Sioux Falls on the east side, Rapid City on the south side, or on the west side. Sioux Falls is a population of about 100 to 120,000 or so, and Rapid City is about 80,000, 85,000. Those are our 2 largest cities. That's where the bulk of our services are. And so we targeted those 2 counties as our target communities for the Second Chance Act grant. What we're doing then is individuals that are paroled to the other programs become our comparison group. They're not receiving funding and services underneath the Second Chance Act grant. That creates a little bit of challenges for us because we're sending folks to a service-rich environment compared to not as rich of service areas, but we're able to match them on LSIR scores, risk levels, those types of things to try to equate as much as possible to see are we able to drive changes in our recidivism rates. You know, that's the challenge in being in a small state, but also one of the benefits. We don't have as many services in the outer areas, but we can really concentrate our efforts where the services are much richer, and we can also target those high-risk folks with the right types of programming and see if we can start beginning to change our rates. So, all right, with that, I'll turn it over to Mike from Oklahoma. Ed, oh, you got one more, okay.
My brag slide.
That's right, I gotta let you have your brag time.
It takes Roland a long time to put together statistics. I can't wait a whole year to see if we're accomplishing anything. But I can track warrants issued because I issue them and I can count. So here's our graph on warrants issued. You can see in about April of 2010 is when we really kicked in the program. That's the red line. And if you start at in July of 2010, the purple line on the bottom, you can see the results in recidivism reduction. Now that's a measure of warrants issued. So that isn't the same measure that Roland was talking about initially. So in the last 7 months, we've had a 24.14% reduction in recidivism as measured by warrants issued. So it can work. The early indications are that we're going to reach that 50% goal. We might even reach 25% of it in the first year. Thank you.
I'm Mike Conley. I run the Evaluation and Analysis Unit for the Oklahoma Department of Corrections. I only have about 4 points to cover, so I didn't do a PowerPoint. Those of you who lost out on the handout over there, I'm sure they'll be available on eBay at some point or another before the conference is over, if not tonight. If you do have questions or you want materials from us, I would be glad to get them to you if you just let me know. Let me give you a quick overview of what we're looking at and of the program that we've created to deal with it, and then I'll talk briefly about our research design, how we get our data, and the key points that we would emphasize from our experience and for those of you who are either into yours or about to start yours. In Oklahoma, about 50% of our releases in any given year release directly to the street. Those that don't release directly to the street are usually on some kind of split or probation. We don't have a lot of parole in Oklahoma. The governor, it's the only state where the governor has to sign off on every parole. The governor for the last 8 years until this year has been a Democrat in a southern state, so you can pretty much do the math on that yourself. Bless his heart. We do, I'll give you a quick overview of the program itself. We do have folks who actually know much more about the program itself. If you have questions, in fact, the young man who may in just a few seconds be diving over this front table and running for the exit is the man who actually runs our program and will not want to be here when you start asking those questions. Pay no attention to him. We have a reentry facility. It's a revised community corrections center in Oklahoma City. We treat high and moderate high risk males. We do use the LSI to determine high and moderate risk. They will be with us in most cases somewhere between 12 to 18 months. There is, that will vary, but hopefully we will be able to coordinate over the 2 years of the grant period. We'll be able to work with up to 200 offenders. They receive the basic evidence-based programming that they might not otherwise have received because of their placement security levels and so forth. They, in many cases, might have been released to the street without any programming at all, which is really a good plan. We use the opportunity of the Second Chance Act to really deal with this population that we hadn't had the money and the opportunity to deal with before. We also, they have opportunities with VOTEC. We do have partnerships or developing partnerships with Oklahoma City agencies, with other state agencies, with local groups to deal with housing, employment, other reentry needs. There actually is, Ed was talking a bit about the handoff here. We actually have in this program the opportunity for our probation and parole people to actually start working with the inmates before they're released. That doesn't happen very much in our system, but this is one where there is a handoff possible for those who are going to be receiving supervision. Those who don't receive supervision, of course, we have to track in other ways. I'll deal with that in a little bit in just a second. Our research design was essentially that we will compare the people in the program after 12 months, 24, their 12 months, 24 months, 36 months, with two other groups. One group will be a group from the Oklahoma County, Oklahoma City area, which the program serves. I should have said that before. And who would have been eligible for the program, say, 12 months before, but it wasn't there. So they had all the criteria, but they didn't receive the dosage, the treatment, the program, versus those who actually got it. And then we're also going to compare them with our other major urban area. We have two major urban areas. Tulsa and Tulsa County, that area of inmates, we will match them on both within program variables and post-release variables, and their key demographics, their offenses, their risk need assessment, education scores, those sorts of things. So we'll actually be doing 12, 24, 36-month evaluations on groups before and after the program, a group that would have had it, a group that did get it, and will be contemporaneous, a group that got it, and another urban group that did not receive it. So hopefully those will both match out the same. We'll see how that works. As I said, It's built in to do the survival analyses after 12, 24, and 36 months so that we can get feedback to the program people within timeframes which will actually be meaningful to them. And we also intend to follow up with the releasees after their release. Those who go to supervision, hopefully we'll be keeping track of them. That's the plan. Those who are released directly to the street, we have ideas for incentives to stay in touch. We have someone committed to keeping up with them, but you know how that goes. But we also plan on offering a financial incentive of gift cards to encourage them to participate in surveys, let us know where they are. Our data provision, we have the basic offender information system. We call it our offender management system. We can get our basic demographic, offense, education, all those sorts of variables off of that. We also have case managers who are supposed to be keeping some records that we will want to fall back on for our analysis. It's interesting, one of our case managers, one of the people working with offenders in the program is from our training program. He was very evidence-based in his approach when he was in training. We did some analysis for them, and he was subsequently downsized in our budget cutting for those of you who want to know what happens to you when you do evidence-based practice. This isn't being taped, is it? But what my point is that we have very qualified people working with the offenders in a case management situation. We also have one of our brightest young men in probation and parole who actually is the intake officer. And he's been very instrumental in working with us, not just in terms of making sure that the data get collected at intake, but he's also been working on the surveys, identifying scales that are already out there, the things that we're going to use to collect data from the very first day these we have been using, to collect data that we will need later from these offenders from the very first day they hit the facility. And specifically designed for the sorts of purposes we're going to need, not just the usual sorts of things, but also now and in the follow-up, so that we can track housing, we can track employment. It's not that easy for those of you who know, and cooperation with other agencies in your state or local communities, that's not always there. And so, to the extent that he's successful, we'll be less reliant on other people to help us find the data that we need to judge some of our measures. There are 4 basic points that I think I would emphasize to you as you're setting up your program and you're trying to figure out how you're going to demonstrate what you're getting out of it and so forth. The first thing, and I have to, not just because they're sitting down here and staring at me, but I have to compliment the programs people, the people who are responsible for putting this together. They understood. I mean, our department is very much an evidence-based department. It comes from the director on down. The people who are involved in this on both the male and the female side, I'm just talking about the male, but we have a female program starting, are people who actually use the data. It's not an afterthought with them. It's something that they use to guide their actions. And so from the beginning, we were able to, they came to our unit and said, what can we put in here to be able to show people that we actually have, we'll actually be able to hit those goals. That 50% recidivism thing, I always tell them, that's no problem. I run the data, I can get you your 50%. Just give me a little time in advance, and we'll 60, no problem. But they really, it's an important thing for them, not just in terms of Second Chance Act, but in terms of everything we do. Our programs unit in the Department of Corrections has a long history of doing survival analysis on individual programs within facilities. doing overall modeling of the way that the various treatment programs interact to produce survival and recidivism outcomes. And so this was something that if you can build it in from the start, you need to. It makes your life so much easier later on. It's not easy to do, but you'll find it's much easier than what you face if you're going back and trying to cobble it all together after the fact. So we built our evaluation component into the proposal that we sent in, and I think it's been demonstrated that that was a major reason we ended up getting the grant, that we were actually going to be able, we would have the data, we would track it from the start, and we would be able to tell successes and failures. Another thing that I would do, and it's something that they've clearly done in South Dakota, is I would encourage you to partner with an independent third party in terms of helping your design and doing your data analysis. Part of that is just simply because when you're the one who is going to be judged by the data that you say are just great, that can be a problem. I mean, internally it's fine for us, the sort of thing that Shelli was talking about. Internally, we can do the analysis because as evaluation analysis, we really don't have a dog in the hunt regarding how second chance is performed. But our analyses from the Department of Corrections are not going to have the credibility with policymakers and the people you need to convince the feds that you actually have accomplished what you are saying that you've accomplished. And so in our case, we started from the beginning. It was actually kind of an accident, but we started from the beginning working with researchers at the University of Oklahoma. We had originally planned just to do an internal thing, but because of budget cuts and retirements, I lost the analyst who was going to do this. And so now I'm scrambling around, how do we figure this out? One of the things that we've done well before this was we tried to establish partnerships with our institutions of higher education in the state to get interns, get research done for free, those sorts of things. It just so happens that our department director and I have an article in this month's Corrections Today on building higher ed partnerships and what they can do for you. I know most of you have already probably memorized it, but it's for those of you who haven't, it's there. I mean, you can wait for the movie. There's some concern about Clooney's availability, but once we get that worked out, it'll be. But, just in general, working at your partnerships with your institutions of higher education, extremely important. And they paid off for us in this because what we were able to do, we went down, and I'm sure Roland did his work for free too, but we were able to find a freshly minted assistant professor who needs publications to get her tenure. There's another all but dissertation young woman who also needs just to get a job. And so we were able to offer them, here's going to be our data. We're not going to control, and I'll get into this again in a second, we are not going to try to control you in any way. We will give you access to this because it's more important that we get a true evaluation of what we're doing than it is, despite what I said a while ago, than it is that we show some preset level of success. And so they will act as our third-party investigator. I know that the feds are planning, can you say feds in here? Okay. All right. The feds are planning to do some evaluation, and that's fine. That's wonderful. We appreciate all the concern and the importance of this issue. But what we gained, I think, by having people from the university there is they were there from the beginning. They know the network. They know what we're after. They have, I think, and I don't mean this as negatively as it's going to sound, but they have a longer-term perspective over what we've been doing and what we will be doing than people that come in and ask some questions for a day or two and then get some data and analyze it and do all that. Not that that's not going to be important, but it does mean, I think, that when we have to defend what we do within our own state, that we're going to be able to go into probably more detail. One of the quid pro quos we went to with them was that when they helped us design the surveys, they're sociologists, so, you know, they want all the stuff, religion, sex, all that sort of stuff. We know pretty much to the sex stuff, but we did the rest of it. So they've got, I mean, they have some benefits coming out of this themselves. But as I said, the important thing is to get somebody who will be acknowledged as not having a vested interest in the results. That's extremely important in the long run. Two other points. One, we work with program staff from the beginning. I went to meetings to make clear the importance of and use of the data collected. I went to meetings with the people who are going to be involved. We've emphasized this in all the settings we've ever had, on second chance with their superiors. The data are important. Again, you've got 12 million things you're doing, and to try to add one or two more things like that, unless they see the purpose on it, it's just not going to be important to them. We tell them this is important because we're going to be judged on this. You're going to be judged on this. This is not something out there that nobody will ever look at. I think the Deputy Attorney General made it clear, Oklahoma, I mean, it sounded really good. Oklahoma has blah, blah, and I'm going, oh my God, they're going to be watching us. So from that standpoint, it's very important to work with your program staff and help them to understand that the data will be important from the start. As I said, the young man who does our intake has basically been the architect of much of what we've done. And I think, and he has a commitment to it. He's an extraordinary young man. Finally, I want to emphasize the importance of flexibility in your design as implementation occurs, as you go forward on this. One of the things that happened to us was we were estimating how many people would be eligible. I mean, originally it was just the high-risk guys. But as we went through and we started looking, and you know, some of the guys we were looking at, as you were saying, no, it doesn't matter what they score out at. And it turned out that we would either have to limit from the 200 to far less, or include the higher, moderate, higher medium risk guys. And so those adjustments were made. Not so much to the design as yet, but here's one of the things, and this is true for program stuff in general. One of the things that you run into is that as you get this feedback that I talked about earlier, you may discover that you've got to make a change in the program while you're doing it, while those guys are going through. And that changes the dosage, if you're going to use that term, that these guys are receiving. Or guys who went through the first time got this, but while nominally it's the same thing, this is different. I mean, we have this problem because we use CPAI and on our programs and stuff. We're not going to tell them, yes, you found this flaw in what you're doing, but keep on doing it until December 31st or June 31st so we can have our fiscal year or calendar year group all get the same thing. That's unethical. And so when we end up running into these kinds of situations, we basically, I mean, we tell them, go ahead and do it. We will let people know what changes occurred when we report the results. But, and you see this, I'm always skeptical of any research, academic research, other departments, I'm sorry, because I don't know, did staff change? Did the staff change? Did the program change? Did something happen in here? So that this group of people you're saying all were the same or compared to another group, actually they didn't get the same thing, or they weren't treated the same way for that whole group, and yet you're reporting that this program is successful or unsuccessful. There's not, if you come up with a good way to deal with that, please let me know. The only way we deal with it is basically by making it clear in our reporting. As Richard Stroker was saying this morning, the important thing here is to get real results. It's not to demonstrate the 50% recidivism. It's not to demonstrate that we had any change. If we run these guys through the program and they come out worse, like the boot camps, that's important to know. And that's what I would encourage you to keep in mind, that running the data and getting results that are as accurate as possible is what we need to know, especially given all the different states that we have doing, and tribes and local governments doing these things. That's what's important. You know, they said that, somebody asked Edison one time, because he said, you know, he had run like 1,400 different materials to try to find the filament for the light bulb. And they said, well, how did you have the patience for that? I mean, after failing so many times, he said, I didn't fail 1,400 times. I successfully identified 1,400 things that wouldn't work. And that's what we're doing with this. Now, if all of us fail, that might have been a waste of money. But out of this, to the extent that you can document and reach sound conclusions about what you're doing, even if they don't demonstrate reaching the goals that we may have set, or maybe even going the other way, that will still be valuable. There's a great book out right now. Our director is pushing it on our department, which is annoying, but it tells you about him. It's called Trial and Error in Criminal Justice Reform by Berman and Fox. And it's like 100 pages. It's all these criminal justice reforms that were tried but didn't make it. But you never hear about them because we never talk about failures. I directed 2 sentencing commissions. I was a research director for a third one. 2 of them don't exist anymore, and it has nothing to do with me. But when I get invited to talk about sentencing commissions and things, I always say it's because my commissions failed, and I'm probably more important than the guys in here whose commission succeeded. Listen to him and don't do anything he did. And that's sort of the thing that I would hope, what I'm looking forward to from hearing from you all, is what you found, whether it worked or not, because either of those will help us. Okay, thank you.
And the panel is willing to take questions or hear any comments that you might like to make.
If I could, one of the things I didn't really get into, but our variables included things not just recidivism, but we're looking at program completions, we're looking at misconducts, changes in security levels where we send these guys back to, those sorts of things, and doing those comparisons as well, so that those are internal measures for us that are going to be more important, but it'll tell us if there are secondary effects of having people in these facilities. If the recidivism number doesn't change that much or whatever, but we still had these other positive benefits, then you end up saying that it may still be worth pursuing.
Hi, Erica Mollett from City of Dallas. Roland, you mentioned that for your comparative data, you compared your success to those who were sent through other programs. How were you able to get the other programs to provide you that data on a consistent basis?
Okay, we're in the process of that now. We were funded in 2009, we're one of those grantees, and so we don't have our first full program year of people through the program yet. But how we're going to be able to do that is all of them are underneath the supervision of parole, underneath ED's agents, and so we'll have the information through their database where they track all the parole services, as well as we'll be able to access the treatment database. We have a way of liaisoning over to our substance abuse treatment providers to look at those services, and since most of them do access the substance abuse treatment services and the mental health services, we'll be able to pull that in as well to see, okay, how many of those individuals that did not go to our target areas receive similar services in those other areas as well.
If there are no other questions or comments, thank you very much.
Thank you.